I've had guys come to me who have crushed their E2 levels with the use of aromatase inhibitors and really are suffering with libido despite the fact So guys, I've got a really interesting case today. Someone reached out to me via email and wanted me to review their blood work. And in this video, I'm going to look at their blood work, review some parameters in their blood work, and hopefully give an insight into what you need to look for if you're on TRT or you're looking to get on TRT in terms of blood work and keeping yourself safe and healthy. This is a really interesting case because Jackson, who reached out to me, he has really good testosterone levels, so his total is quite high, but his free testosterone is incredibly low due to SHBG being high, and this has some important clinical implications in terms of the free hormone hypothesis. And this is the idea that free testosterone is the only real form of testosterone that is able to enter and cross the cell wall and enter the cell and exert its cellular effects in terms of growing muscle, in terms of brain chemistry, in terms of libido, muscle mass, energy, confidence, and things like that. So if we do open up his blood work, we see that his total testosterone is 829 nanograms per deciliter this year, which is not actually that bad, keeping in mind this is a young healthy male of 24 years old, so a level of 809 nanograms per deciliter is actually very good. But because his SHBG is 63 nanomoles per liter, which is incredibly high, it means that his calculated free testosterone is actually way down at 67, which is pretty close to the bottom of the reference range, and really evidence here that high SHBG levels can absolutely bind up all of that total and leave you with a very low free testosterone level. If the free hormone hypothesis is to be believed, free testosterone therefore is the only thing that can cross cellular walls and exert its effects outside the circulating total testosterone, in which case Jackson may be suffering from lower energy, lower libido, lower muscle mass, and generally lower testosterone symptoms because the total testosterone is all being bound up by the SHBG. SHBG is one protein that binds to total testosterone very strongly, the other one being albumin more weakly, but evidence here that his total testosterone is being bound up and putting his free testosterone, even though he's at over 800 nanograms per deciliter total, putting his free way down under 70 picograms per mil, which is pretty terrible as a testosterone level. Now his bioavailable testosterone, which is bound to albumin, is also quite low. Again, evidence that the total is being held up not just by SHBG but by his albumin levels as well. And if we do look at his albumin levels, I'm expecting it to be high, and evidently it is at 4.7 on the higher end of the reference range. So it's not just SHBG that's holding up his total testosterone, it's also his albumin levels too. There are some ways to reduce SHBG. I've done this in another video, one of the most powerful being boron at 3 to 5 milligrams per day. If that doesn't work, there are some second tier supplements to try and reduce SHBG, as well as dietary interventions like manipulating your protein and your carbohydrate intakes. This may be an option for him if he is suffering from those low testosterone symptoms as a result of his free testosterone being so low. Looking at his lipids, so his lipid panel looks quite good. LDL is relatively low, which is good. His HDL is over 40, which is usually quite a good level, meaning that his total cholesterol is under 200. But for the clients who work with me, just looking at LDL, HDL, and cholesterol isn't the full story. For everyone who works with me, they know that I recommend getting apolipoprotein A and apolipoprotein B, and the ratio of ApoA to ApoB tested. These are more specific proteins that are found on HDL and LDL and give a very useful insight into the specific risk. And in most studies, ApoB seems to be a very powerful predictor for heart disease and plaque accumulation. A few years ago, his ApoA was 138 within reference range, and his ApoB was very good, very low at 58 under 90, which is quite good and evidence that he's not going to have any significant plaque accumulation, hopefully for a little while, if he can keep his apolipoprotein B quite low. This is a very potent tool to analyze your plaque accumulation risk if you are on TRT or a cycle, and something that I really consider a non-negotiable for my clients who are looking to optimize their blood work, and in particular if their lipid panel is out of whack or out of range. Apolipoprotein A A and B, and the ratio can be incredibly powerful for determining that risk. He also got his CRP level, C-reactive protein, a marker of inflammatory processes in the body, less than 0.3. That's perfect there. No issues with chronic inflammation in his body at all. His overall metabolic panel looks quite good. Glucose within reference range. His body seems to be tolerating glucose well in terms of insulin release. Nitrogenous waste seems to be fine. Creatinine slightly high. This can be as a result of training the day before, for example, with muscle protein breakdown and turnover. EGFR 81, that's good. Estimated glomerular filtration rate, a measure of how well his kidneys are functioning. Sodium, potassium, chloride all look good, and the rest of his general parameters look good. In terms of calcium, his total blood protein as well as his CO2. Like I mentioned, albumin being slightly on the higher end of reference range means that his bioavailable testosterone as well as his free are both on the lower end of normal. And then if we look at his liver enzymes, the ones that break down, for example, amino acids like AST, ALT, it's not showing any significant liver damage or inflammation, which is quite good and healthy. Now his HbA1c, which is showing his blood sugar levels over the past couple of months and really a range for where he's sitting in terms of his blood sugar control in his blood, 5.3%, so that's totally fine, well within reference range. Again, more evidence that in conjunction with his glucose test, he's not showing any significant issues in terms of insulin sensitivity or glucose control. IGF-1, 188. This can be quite varied in people, but within reference range, and if he did want some more anabolic stimulus, he could manipulate his natural IGF-1 or growth hormone levels by, for example, using a sauna throughout the week to initiate heat shock protein activation and thereby increase growth hormone and IGF-1 levels. That's just a little recommendation that he could use. What is interesting is his DHT is upper end of the reference range at 62 nanograms per deciliter, which is relatively high, and evidence that his total testosterone is being quite easily converted to DHT. It's just that it's still being held up by SHBG and albumin, like I mentioned. All of his blood parameters look relatively good. His hemoglobin at 15.7 and his hematocrit at 45.4% is very good and not showing that his blood is overly thick. Hematocrit levels above sort of 52, 53%, then you're starting to get into increased red blood cell production, and really thick blood on TRT or on steroid cycles is incredibly dangerous and puts you at a higher risk of blood clotting and stroke. You don't want thick blood, and I tell this to all my clients, you don't want thick blood. So keeping your hematocrit low on TRT is a very good idea, because anabolic steroids and any form of anabolic agent can increase red blood cell production. He might have had a little infection, as his eosinophils are slightly high at 536, but the rest of his immune functioning looks relatively good and white blood cell parameters look good. Iron stores look good, and there's no real need for him to supplement iron at this stage. DHEA is within reference range. Again, no need to supplement. Some guys who get on TRTs have a slight down regulation in DHEA, which is an important neurosteroid and involved in the pathway of cholesterol to testosterone synthesis. So injecting testosterone in some men I've found and some clients I work with has decreased their DHEA levels. But in this case, I wouldn't recommend any DHEA supplementation in absence of big neurosteroid deficiency symptoms like brain fog or inability to concentrate, or generally not being able to really focus on anything for long periods of time. It would also be nice to see a pregnenolone test in here too for Jackson, because that is the other neurosteroid in conjunction with DHEA. Vitamin D at 70, pretty much smack bang in the middle of reference range, so great there, and no real supplementation needed in that case. Going back a few years, we get an E2 or estradiol result at 28, so slightly high here. I'm not sure Jackson's body itself and how he looks, but my guys who are holding a significant more amount of adipose tissue or fat tissue can have slightly higher E2. The enzyme that converts testosterone to estradiol, which is the aromatase enzyme, is found highly prevalent in fat tissue, almost more than any other tissue in the body. Guys who carry a significant amount of fat can have a higher conversion, just simply due to the fact that they have so much more aromatase enzyme activity. This is also another reason why guys who take sub-Q testosterone seem to have higher E2 levels on average, because the subcutaneous administration route into the fat seems to really spike E2 levels and can really mess with some guys who don't tolerate high E2 levels very well. E2 outside a very narrow range, I've done a few posts on this, but outside a narrow range seems to really affect libido significantly, and in a lot of research studies, high E2 can be a huge suppressant of libido in men and male animal studies. So E2 itself is important. So high E2 levels can cause that, but the flip side is low E2 levels can also cause significant issues. I've had guys come to me who have crushed their E2 levels with the use of aromatase inhibitors and really are suffering with libido, despite the fact that their total test and their free testosterone levels are sky high. They're still suffering with big libido issues because their E2 outside of narrow channels seems to really affect most of the the guys that I work with, and this is backed up in most studies as well. His thyroid T3 and T4 functioning looks quite good. T3 and T4 being important in energy and metabolism. This is quite good, and no evidence of thyroid issues at this stage for Jackson. His LH and FSH levels look quite solid, and this is really to be expected considering his total test is over 800. His LH at 5.0 is a very, very healthy level, and proving that the hypothalamus and pituitary part of his HPT axis is functioning well. However, his prolactin is slightly high, so this may be evidence that there may be a medication in there causing a high prolactin level. Antidepressants, for example, and antipsychotics can increase prolactin, so I'm not quite sure if that could be a reason here. And that's about it for Jackson's blood work. So guys, really evidence here that despite having a good total level of testosterone, there is some room for optimization in terms of reducing his SHBG level if he wants to potentially feel better. If he's having some low testosterone symptoms and wants to feel better, there's some definite room to optimize his SHBG levels. And that's a little bit of a run through of things that you might start to look at if you are on TRT or thinking about it in terms of your blood work. There's a lot more, but I don't want to make this video too long. If you are interested in me having a look at your blood work, feel free to reach out to me and I will do my best to respond to you. Keep in mind that I am quite busy at the moment, but more than happy to take a quick look for you if you have a question for me. Guys, thank you so much for the support. I'm really appreciating all the comments and everything on this channel. It's just been amazing how much support you've given me, and the emails and the constant messages on Instagram that I'm getting about, you know, helping you and turning your life around, and guys coming off PCT and starting, you know, TRT, and them just saying what a difference I've made in their life. I mean, it's really nice for me to see. I've always just wanted to help you guys and, you know, really keep everyone safe and healthy no matter what lifestyle decisions or supplement or cycle decisions you decide to do. There is a healthy way to achieve your goals, and you don't need to be, you know, killing yourself with anabolic steroids to get there. So yeah, I really appreciate all the support, guys. It's been amazing. Yeah, so thank you so much, guys, for the support. I really appreciate it, and I will see you in the next video.